Hey everybody, George from Redox here, coming at you from Health Further 2017 in Nashville. Today I'm joined by Al Berning, CEO of Ambient Clinical Analytics. Really exciting company doing awesome stuff in this space. So Al, can we start? Can you just introduce Ambient Clinical and what you guys are working on?
Sure. Well, thanks, George, and thanks for having me on tape. Ambient Clinical Analytics started about 3.5 years ago, and we licensed a suite of technology from Mayo Clinic that provides clinical decision support tools. And the differentiator, what makes ours unique, is it's at the point of care, and it's in some of the most critical care areas within the hospital, the ICU, emergency department, and it takes all the data within the EMR, and we'll use Redox as a connection point, and then allows the clinical team to see what's most important in that particular patient. So, for example, sepsis is one of the leading causes of death in hospitals. It's a big problem across the United States and around the world. And one of the products that was developed by Mayo Clinic is what we call our Sepsis DART system. And that'll take the information that comes in from the clinical systems, and when the conditions of sepsis start arising, it'll alert the care team and alert them immediately, because in the case of sepsis, if you catch it early, you can cut the mortality rate in half. There have been multiple studies from Mayo Clinic and others say that if you electronically monitor for sepsis and then you catch it as early as possible, you have a much better chance of successfully treating it. And then the tool will also track the treatment of sepsis through what's called the bundle of care, which per CMS guidelines has to be provided over a 4 or 6 hour period.
So what I want to kind of go into is when someone's not using a product, from Ambient Clinical to catch sepsis, I mean, what's the alternative? What's the status quo in health systems today?
In many cases, or most cases, they're actually charting it and plotting it manually. So either the nursing team or clinical team would be writing things down and watching for an elevated or decreased blood pressure or elevated lactate count, and then when that happens, they'd start the sepsis protocol. In most cases that works fine, but in many cases where there's a shift change, or their staffing isn't quite where it needs to be, or there's too many things going on, all of which happen in the hospital, sometimes things fall through the cracks. And when that happens is when the delayed protocol deployment will start, and that's where you're at higher risk of either dying or having a much longer stay in the ICU because the shock has taken over your body. So what we're excited about is by having an electronic monitor, the clinical team still does the work and makes the decisions, but by having an electronic monitor watch everything continuously, they can essentially give an assist to the clinical team and let them know when something's going off track.
It's fantastic. So from Health Further 2017 in Nashville, we have Al Berning with Ambient Clinical Analytics doing really amazing things in the space. Make sure to check them out. Thanks again.
Yep. Thank you.
Yeah.